My name is Mark Blatstein, the physician founder of Physician Pre-Sentence Report Service, Physician Prison Consultants. My phone, 240-888-7778, and I welcome everyone for listening in today. So today we're going to talk about False Claims Act compliance. I'm not an attorney, but I'm going to try and impress upon you the need to protect yourself because this touches healthcare and non-healthcare a lot. It appears that the Department of Justice has taken, I don't know, 70+% of their efforts and workforce away from addressing criminal factors and going after civil and immigration. And so civilly, they're going to be going after healthcare, life sciences, pharmaceuticals, tariffs. They're going to be going after. You want to make sure that you're documenting and you're not trying to evade tariffs, because on the healthcare side, they're going after civil penalties because they want to get paid. It's well known that if they go after healthcare, either corporate CEOs or physicians or marketing groups or hospitals, and they go after them criminally, there's really no money at the end of that rainbow. They go after them civilly, there's money to collect. Tariffs, if you try and fool the government, they're not going to go after you civilly. They will go after you criminally, which we'll address. And that I read about today is July 29. I read about that yesterday or today, I forget. And then there's trade, and then there's whistleblower award programs. And the Department of Justice has been really trying to expand their reach on whistleblower. Again, Pre-Sentence Report Service, pprsus.com. My name, Dr. Blatstein. Phone number again, and let's get to this. I'll try and not go too fast. Tariffs are going to be, this is a big part of the president's package. It is a tax. It's going to make the cost of goods higher. Nobody's really sure how this is all going to wash out in the end because it's really been on again, off again. Healthcare, this also has been kind of a nightmare for providers, which I'll go into in a minute. Life sciences, again, this involves really everything from, in addition to pharmaceuticals, but it's manufacture of, it's either software or it is medical devices or it's implantable medical devices, or it's really everything that makes, that it's everything that goes into, the crossover between healthcare and your life. So let's continue. In the crosshairs, there are going to be kickbacks. Medicare Advantage plans are for the first time are going to be in the crosshairs of the Department of Justice. In addition to selling techniques where the policy doesn't provide what the end user actually needed, since I've been in practice, which has been 1985, I should have a nickel for every time patient would from the northern part of the country went to the southern part of the country as a snowbird and came back complaining because they had insurance, but the doctors down there didn't in the southern part of the country didn't take Medicare. When I looked at their Medicare, I told them it wasn't Medicare, it was Medicare Advantage. And Medicare Advantage is not Medicare. It's similar, but it's not Medicare. It's almost an health maintenance type organization, but it has extreme conditions to it, depending on the plan that you take. And so it's definitely been sold as Medicare, but it is not. Drug makers, medical devices, biologics, and discounts. Biologics is everything, including, for example, drugs that treat myasthenia gravis that I have a friend of mine who's taking now. And it's, and this drug has only been on the market under a year, but it's helping him. And this guy's the picture of health, a Boston Marathon runner. But specifically, there are discounts, rebates, service fees paid by the pharmaceutical agencies or medical device companies just to be placed in the insurance company's formulary. Will these funds be passed on to the patients or be kept by the brokers? barriers to patient access, and violations of network adequacy requirements. It's a relatively new category of enforcement dealing with compliance and requirements for provider networks, Medicare, Medicaid, and Affordable Care Act exchange plans. I don't know that I agree with the Affordable Care Act exchange plan, but this is, will have to be washed out as that it's a brand new category. I hope that this category is not going to try and be the kiss of death to the Affordable Care Act, because then this is not an honest category. Well, any kickback statutes are old hat. They continue to be a source of significant exposure for providers and plans alike, and it's true. Defective medical devices, this should be, just like vehicles, that once they're identified by the manufacturer, they need to impact safety. They need to have a recall. And this is a big deal because I have another YouTube on this regarding a company that specifically goes into the importance of taking ownership of your own billing and coding. You are still responsible. If you have outsourced your healthcare billing and coding service providers, as well as software companies that develop billing and coding tools for providers, you're facing scrutiny. Well, I call it the dumb doctor defense. You are responsible, period. CMS rolled out this thing called WISER, Wasteful and Inappropriate Service Reduction Model. I haven't gone through this, but how does it work? It's a test model. It's limited in a few respects. The reviews will only involve original medical plans. Medical Advantage will not be effective. Only specific subset of items and services will be reviewed during the pilot phase. These include skin and tissue substitutes, electrical nerve stimulant implants, and knee arthroscopy for knee arthritis. Very common procedure. The model excludes implant-only services, emergency services, and services that would pose a substantial risk to patients if delayed. The announcement indicates participants will be required to have clinicians validate the technology-driven determinations. The culture wars. These are a mess, as now politics are going to push its way right into your doctor's treatment room in medicine. The Department of Justice leadership has issued multiple memorandums stating the agency's intention to pursue false claim acts against providers, hospitals, pharmaceutical companies, and others that provide gender-affirming care. So what I've seen recently is you have these excellent children's hospitals around the country that are now getting subpoenaed by the Department of Justice. This is crazy. It's nuts. These are the best of the best. And this is why, while the highest court in the land, the Supreme Court, has been up there and written in English that they try and take us back to the life of the 1860s. Just continue with doctors, just continue just to do your best, not listen to the noise and move forward. Dollars are tight. And with this change as Medicaid has been reduced or taken away, that this new plan, not the new plan, but with the destruction of healthcare in this Congress of 2025, we're going to see hospitals close, and everyone's going to trying to seek a novel way to save money. And a word of caution is the Department of Justice doesn't care. Don't stray across the gray line, because they're not going to care that you're trying to do the right thing and save patients' lives by making a little bit more money and crossing that gray line. They do not care. All they're going to care about is another, convicting someone else. They have artificial intelligence and analytics, and they're watching all billing 24/7, 365. United Healthcare, this is one of the probes. Preparing for enforcement is like everything else. You want to be documented. You want to be correct, conducting regular audits, assigning proper customs valuations and caption. Essentially, for those of you that are involved with importing your components from overseas, you're going to be criminally prosecuted for tariff evasion. And that's just the reason for this recent post. This was an article I just read today. Could have been published a few days ago. Today's the 29th of July. But while everything has been civil, criminal prosecution for tariffs appears to be on the criminal side. If you sense trouble, you need legal representation. It's better to have it at the end of your phone call list than not. And as the Department of Justice is interested in civil charges and penalties, pay the piper. really. Otherwise, it's easier to pay the money because civil charges today can become criminal charges tomorrow, and you don't want that. And it should it turn into criminal. Here's the link, the list of about 12 to 14 questions as you interview attorneys, criminal, as you pick legal counsel. Check these out. Let's see if I can open this up without creating a problem. And let's see if this opens up my comments. So here, choosing an attorney, the right, and these are questions, everything you want to ask an attorney before you go ahead and you plop money down because they're expensive. It could be several $100s an hour. It can be several $1,000s an hour. And then consider the benefits of engaging my services in preparing for the non-legal nuances of your defense, which can be significant. I appreciate you taking the time to listen in today. I hope you have a safe day, and thank you for your time.